Paruresis, or shy bladder syndrome, is a social anxiety disorder affecting one's ability to urinate in the presence of others. This condition disrupts everyday activities like using public restrooms, leading to severe distress and avoidance behaviors. People with paruresis might avoid social events or travel due to the fear of not being able to urinate when needed. The disorder ranks second only to the fear of public speaking in terms of common social phobias. The impact of paruresis extends beyond physical discomfort. It affects emotional well-being and social interactions. Those who suffer from this condition might feel isolated or embarrassed, avoiding conversations about their struggles even with close friends or family. This avoidance can perpetuate a cycle of anxiety and withdrawal, exacerbating the disorder. Paruresis can vary in severity, with some experiencing mild discomfort while others are unable to urinate outside their homes. Bringing awareness to paruresis helps in reducing stigma, encouraging people to seek help without embarrassment or fear of judgment. For many, the first step towards managing paruresis is recognizing and accepting the condition. With the right support and treatment, individuals can reclaim their comfort and confidence in social settings. The roots of paruresis can be traced to a complex interplay of psychological, biological, and cultural factors. One primary reason is social anxiety, where the individual fears being judged negatively by others. This fear can be so overwhelming that it physically inhibits the ability to urinate. The anxiety linked to social scrutiny often exacerbates the condition. Past traumatic experiences can heavily influence the onset of paruresis. Individuals teased or humiliated in public restrooms may develop an intense fear of similar situations. Biological factors, including genetic predispositions, may contribute to paruresis. Cultural influences and societal norms around privacy can shape how individuals perceive urination in social settings. At the heart of paruresis lies social anxiety, a pervasive fear of negative evaluation by others. This fear is particularly acute in public restrooms where individuals feel exposed and vulnerable. The presence of others can trigger significant anxiety, making it challenging to urinate. The body's fight-or-flight response inhibits normal bladder function. Anticipation of using a public restroom can lead to heightened anxiety. Avoiding fluids or restrooms intensifies the fear and anxiety. This behavior disrupts daily routines and entrenches the disorder. Therapy and support can significantly alleviate symptoms. Cognitive behavioral therapy is effective in addressing social anxiety. Reframing thoughts and practicing new behaviors can reduce anxiety. Section 4. Past trauma and self-esteem issues. Past traumatic experiences are often pivotal in the development of paruresis. Incidents such as being bullied or embarrassed in a restroom setting can leave a lasting impact. These experiences can imprint a strong fear response, making the individual hyper-aware and anxious in similar situations. Addressing these traumas through therapeutic interventions can be crucial in mitigating their impact and aiding recovery. Therapy can help these individuals process their past experiences and reduce the emotional charge associated with them. Techniques such as exposure therapy can be particularly beneficial, allowing individuals to gradually face their fears in a controlled and supportive environment. By confronting these fears, individuals can desensitize themselves to anxiety-provoking situations. Low self-esteem often goes hand in hand with paruresis, as individuals may feel inadequately equipped to handle social scrutiny. Building self-esteem through positive affirmations, self-compassion, and success experiences can be an integral part of overcoming paruresis. As self-esteem improves, individuals often find their social anxiety diminishes, leading to a reduction in paruresis symptoms. Cultural influences can also play a role in shaping self-esteem and perceptions of privacy. Encouraging a more open dialogue about paruresis can help reduce stigma and foster a supportive environment for those affected. Section 5. Diagnosing paruresis. Diagnosing paruresis involves a comprehensive evaluation by mental health professionals. It starts with a clinical interview, where the clinician gathers detailed information about the individual's symptoms, history, and the impact on their daily life. This interview helps to differentiate paruresis from other medical conditions that might cause similar symptoms, such as urinary tract infections or bladder dysfunction. Psychological assessments often follow the initial interview. These assessments use standardized questionnaires to evaluate the severity of anxiety in various situations, providing a more objective measure of the condition's impact. Tools such as the Social Phobia Inventory or SPIN can help quantify social anxiety levels, offering valuable insights into the individual's specific challenges. Another critical aspect of diagnosis is the exclusion of other medical conditions. Medical evaluations might be necessary to rule out physical causes of urinary issues, ensuring that the focus remains on treating the psychological aspects of paruresis. Collaborating with healthcare providers across disciplines can ensure a holistic approach to diagnosing and managing paruresis. Proper diagnosis is the first step toward effective management, offering hope and clarity for those struggling with this condition. Section 6. Treatment options for paruresis. Treating paruresis involves a range of therapeutic strategies, with cognitive behavioral therapy, or CBT, being one of the most effective. CBT helps individuals identify negative thought patterns and replace them with more constructive ones, reducing the anxiety associated with urinating in public. Exposure therapy is another powerful treatment option involving gradual exposure to anxiety-triggering situations. Starting with less intimidating scenarios, individuals slowly confront their fears in a controlled environment. Over time, this desensitization reduces anxiety and increases confidence in handling public restroom situations. In some cases, medication may be prescribed to manage symptoms, particularly for those with severe anxiety. Selective serotonin reuptake inhibitors, or SSRIs, or anti-anxiety medications, can help reduce the overall level of anxiety, making it easier to engage in therapeutic activities. Medication is often used in conjunction with therapy, providing a comprehensive approach to treatment that addresses both the psychological and physiological aspects of paruresis. Support groups and self-help strategies also play a crucial role in managing paruresis. Together, these treatments offer a multifaceted approach to managing and overcoming paruresis. Section 7. Overcoming paruresis, a path to hope. Living with paruresis can be challenging, but it is important to remember that recovery is possible. Seeking professional help is a vital step toward managing and eventually overcoming this condition. Mental health professionals can offer tailored treatment plans that address the unique needs of each individual, guiding them through the recovery process with support and expertise. The journey to overcoming paruresis requires patience and dedication. It is not uncommon for individuals to experience setbacks, but persistence and a commitment to treatment can lead to significant improvements. With the right combination of therapy, support, and self-help strategies, many individuals find they can regain control over their lives and reduce the impact of paruresis on their daily activities. Support from family and friends is also crucial in this journey. Understanding and encouragement from loved ones can provide much-needed motivation and reduce feelings of isolation. Encouraging a culture of understanding and acceptance can help break down the stigma associated with paruresis. By taking proactive steps toward treatment, individuals can reclaim their confidence and enjoy social interactions without the burden of anxiety.